But yeah, so yeah, I'm Flora, and I'm lead nurse at the Bridge, and kind of along with a couple of other colleagues set up the Bridge Clinic. Next slide, please.
Is it not moving?
There we go. Great, thank you. I'm actually sorry, Sam. Can I be a little bit annoying? Can I skip 2 slides ahead? Because I've realised I think it will make to the next one. Perfect, thank you. I think it makes more sense to do it this way around. So the Bridge Clinic is a primary care service which is for trans and non-binary people. We're operating in South Southwark only at the moment, within our local federation. That's how we're running. So we are a monthly clinic, just one evening a month on Tuesdays, and we offer routine GP care, but also support with gender affirming care. So as Stuart mentioned, lots of trans people find it really difficult to access care, and there's a lot of barriers to accessing care. So setting up a specific clinic where trans people feel and non-binary people feel safe and kind of understood to when accessing care is really important. So as you can see here, we've got the list of what we do. So the routine GP care. Is someone put themselves on mute? Be good, thank you. So yeah, all the usual routine GP care, including all those screenings which were mentioned, particularly cervical screening is one of the things I at the clinic do quite a lot of. And initially when I started the Bridge Clinic, it started as a cervical screening service only, because there was a real gap in trans non-binary people accessing their cervical screening, and also that was something I could start in a relatively simple way. Then kind of the other half of what we do is supporting gender affirming care. So that's prescribing bridging hormones, which bridging hormones are when a GP can prescribe a bridging prescription once a patient's been referred to clinic, so in this case gender identity clinic, and they're awaiting a first appointment, because currently the wait time is, well, the statistics, official statistic is 5 years for a first appointment at the gender identity clinic, but in reality it's actually even longer than this. So it's important that we give patients care whilst they're waiting for that first appointment, and GPs are able to prescribe those gender affirming hormones. One of the issues is, and the reason we set up the Bridge, that many GPs don't feel comfortable prescribing hormones due to in the most part lack of training in the area. And in fact it is relatively simple things to prescribe. So the way the clinic works is we have myself, a nurse, 2 GPs, a healthcare assistant, and a clinic coordinator. Sadly, our health and wellbeing mentors left, but that was a really useful person to have as part of the service. So everyone who comes to the Bridge will be booked in for an appointment with the nurse or the healthcare assistant. And that's kind of a general sort of health check, similar to an NHS health check appointment. So that's really important because we're collecting information around smoking, alcohol, doing those basic checks like blood pressure checks, which often trans people don't get to have because they're not so much accessing healthcare. And then after that, they'll see the doctor if they need a GP appointment, whether that's for prescribing hormones, and they'll go for an assessment with that, or for another kind of routine GP appointment. So I will, sorry, if I can just go back now to the 2 slides back. Great, thank you. So these pictures are showing, these are the members of the bridge team. I'm very lucky to work with some very good friends at the bridge, and we started by, it was, well, it sounds a bit arrogant to say this, but it's rather true. I was the one who kind of had the real passion around improving trans healthcare for many years. I kind of brought in various people to help me. So one of them was Dr. Becky Stevens, who's a local GP, who's quite senior in the area, and she was able to sort of help us create a funding application and get in contact with right people within the PCN to apply for funding. Another was Dr. Max Kellen, who works with Clinic Q as well, who have been very, very important in supporting us. Clinic Q is a trans health and wellbeing service, and they run a weekly sexual health clinic for trans people at King's, and they're really well trusted service within the community. They've got an excellent name and very well respected, and they really gave us a lot of support in starting our service. If next slide, please. You can see in this picture, we've got the both the bridge and Clinic Q teams, and then we've also got someone there who's a mentor from Spectra, who are another trans health organisation who provide health advocates. So working with other groups and services in the community has been really important in developing our service. Yeah, we also have run kind of community focus groups during the development of the service. So yeah, community is, I think, very important when you're trying to reach these hard to access groups. Working with the community and well trusted names is really fundamental to ensure that you're going to get the trust. Next slide, please, or next two. Yes, this just a little one. Possibly, I mean, lots of people won't be in the area, but the way patients access the bridge is by emailing this email address, and they have to be registered within at a surgery within the Southwark Federation, which is sadly quite limiting. We do have lots of people emailing from outside the area, but we are hoping to expand. Hopefully very soon to North Southwark, and who knows after that, the further the better. They then email, so they email that all those emails are triaged by me, so it's quite important, I think, that they have kind of straight away from the first contact someone who is understanding of the community and the needs, because one of the barriers people have accessing care is just from that first interaction, say with reception, where there's risk of misgendering or often accidental but prejudice. So that's a really important touch, I think. Next slide, please. So some of our patient figures. So we started in December 2022 up until June 23, and it will be higher now because we've almost a year of running the service. So we've had 40 new patients, 90 GP appointments, 37 follow-up appointments, and 72 nurse and healthcare assistant appointments, which those kind of health checks. And we're getting very oversubscribed now, and we've got to wait for an appointment is now about 8 to 12 weeks. Also within that, I think quite relevant figure for this is I've done about 6 or 7 smear tests as part of the service, and every single patient who is eligible for a smear, I make sure that they're up to date with that, and that's always offered to everyone who needs it. Next slide, please. So yeah, we become very popular, which is great, keeping us busy. And about a third of our patients, we give a feedback form and also a form actually at the beginning of the clinic, which gathers some data. And a third of patients have actually registered at a new practice within South Southwark to access the service, which I think really reflects how needed a service like this is. And I anecdotally have been told that someone actually moved house in order to live within the area so they could register at the bridge, which in a way quite shocking, really, that people having to go to those measures to access care, which they should be getting anyway, kind of, that they're entitled to. Next slide, please. So from a kind of more cancer specifics side, we've got the cervical screening, as I've mentioned, and we also make sure all our patients are aware of what screenings they are eligible for and should be accessing, and how to access them. We've done a couple of 2-week referrals as part of our routine GP appointment, and I think another really important part is the collecting the data, which I think Stuart did mention, that data is often lacking for this population. So even though it's only a very small group, small numbers at the moment, we've already found from reviewing our data that 38% of the bridge patients smoke compared to 12.9% of the general population. So just slowly over time, even with these small numbers, we're building a collection of useful data around risk factors and things like that. We did also, on the back of that risk factors, have a health coach as part of the team, which was really useful. They were non-binary themselves, so patients felt very comfortable with them, and they were able to provide support on stop smoking and other sort of health behaviours. The average age of bridge patients is fairly low, so I think at the moment their risks of probably cancer at the moment is fairly low for most bridge patients, but it's really important that we're building those relationships now and building that trust with them, so that when the time comes, they are more, or when they do develop higher risk or worrying symptoms, they feel more comfortable in accessing healthcare, and they're also getting that education around what cancers they're at risk of, health behaviours to reduce their risks, and it's kind of that long-term, probably more long-term work with our cohort. It's not to say obviously that cancer doesn't occur in these younger age groups, but it's building that long-term trust and relationships. Next slide, please. So sorry, this is quite a wordy one. I will just briefly go through it, but I think it really demonstrates how a service like the Bridge can, even though it's not cancer specific, is really helping improve people's access to cancer care and risks. So we had a non-binary patient in her mid-50s. Sorry, see, we all misgender people all the time. That's another thing to remember, but it's just about correcting yourself when you do it. They attended the Bridge. They had not accessed any health services for over 15 years due to trauma around healthcare. They hadn't had a smear for, I think, more than 15 years. They attended with a trans health advocate, which was really helpful. So it was a huge, huge thing for them to have even come to our service. And they were, at first, there was a bit of antagonism from them due to their poor experiences, which is very understandable. And they came with a very long list of symptoms. So it was quite complex work for the GP to work through and kind of prioritize what issues needed addressing first. But one of the concerning symptoms was intermenstrual bleeding, and there was a number of symptoms, basically gynae symptoms, which fit the criteria for a 2-week wait. The patient didn't consent to a smear test. In fact, that was one of the things they had particularly poor experiences of, and we'd actually been contacted by their advocate prior to the appointment, asking us not to mention smear tests for now. They also declined a 2-week wait referral, but one of their symptoms was very heavy and painful periods, and the GP who they saw prescribed some tranexamic acid, which massively improved their symptoms. The patient came back a couple of months later and they were a lot more trusting because the positive effect tranexamic acid had. It really made them a lot more trusting of our service. So we haven't quite managed to get them to consent to a smear test, but we are very slowly getting there, and we're just slowly rebuilding that trust of a patient who's, to be honest, really been let down by previous healthcare providers. So again, it's that important kind of building trust over time with patients that's really important, so that we can enable them to access the care they need. Next slide, please. So yes, this one's a bit about the community involvement, which I mentioned before, really. I think another important fact is all our team identifies as LGBT+. So we kind of got our patients can see a little bit of themselves in our team. And yeah, running a focus group prior to starting the service was really important to get the opinions of what do trans people actually want to see from their healthcare, and what would make it easier and more accessible for them. As I mentioned, we give all our patients, when they come, a form in the waiting room to fill in about their previous experiences of healthcare and other health data. We also send a feedback form to all patients at the end, and that's really, really important as a new service, so we can get patients' feedback and hear what they found useful, what they think could be made to work better, and kind of continually getting that input from them. So it's very much a patient-led service. And another kind of, I in particular and the team have a lot of connections with local trans people and trans community, and it was through those connections we were able to reach patients. For example, when we started sending posters about the bridge through local trans community WhatsApp groups, putting the posters up in local LGBT plus spaces. That direct grassroots approach is really important. Next slide, please. So I think that community, one back. Thank you. That community approach has been really, really important in making the service work well for our patients, and that's why we've had so far really, really good feedback. So 100% have said they are very satisfied, 100% would return to the clinic, and 100% respond to their clinician has a good understanding of their needs. So that's been really, really great to hear from our patients, and it's this feedback, positive feedback, and also the number of patients we're getting, which has been very useful information in asking and kind of going about planning for expanding the service. And I think there's this very touching comment from a patient we received, which is, thank you so much for everything you do. It's amazing to finally feel like someone in the NHS is listening to me. So yeah, that was really nice feedback to hear. Next slide, please.
Yeah, I'm just going to remind you about time as well, Flora. So you've probably got
yeah,
2 minutes to go.
That's fine. This final slide, I think I won't really go into a lot of it's Stuart discussed in their talk, and it'll be useful. You can have that in the slide pack. But yeah, that's the bridge clinic. Let me know if anyone got any questions. Be very happy to answer them.
Questions for Flora? I might just kick that off then with a question about funding then, Flora. Where does your funding come from, and how do you see that kind of panning out in the future?
Yes, so funding, always the big question. So we got our funding initially, and it was with the help of the lead GP I mentioned, but Becky Stevens, who helped us kind of find good places to get the funding. But so we're funded by, there was a Health Inequalities Fund from Partnership Southwark, which we were given funding initially for a year. It was sort of a case, luckily we did have quite good support in the area within our federation. It was sort of, because there's not really an existing similar service, it was kind of a case of saying, trust us, we think this will work really well. It was quite hard to find a lot of data to support it. And they gave us the funding for a year, and we're now at the point where we're looking back over last year, collecting all the data, and we have just received, or we're planning our expansion to North Southwark actually at the moment, which is really exciting. We've had that funding confirmed. Currently it's only for a few months. We're hoping again the same thing will happen, that once the service is up and running, we'll continue to be funded. But yeah, that's the big issue. I think something to add though around funding, it is a relatively very cheap service to run when you compare it. It's one evening clinic a month, 4 hours for a team of 5, and then I charge for a couple of hours admin, doing all the emails and triaging a week. So it's not too costly when you think of the effect it's having on people's health, and I think the poor health and the cost of that down the line that we're preventing.
Thank you. And it sounds like you're collecting some good data to support that as well. So good luck with your bids for future funding. I've got a question there from Diane. Do you want to ask something?
Yeah, hello, Flora. Just out of curiosity, really, obviously you've got people coming to you who've had difficulties accessing care. Are you able to feed back to their old GP practices? Oh, obviously it's about capacity, and you're doing a great job anyway. But is there any thought of that? Because whilst they're having problems accessing care, local primary care or wherever, these groups of practices may not be aware of this. And what would be, how would you envisage that, or would that be beyond your capacity in your current stage?
So I think we haven't so much done direct feedback, but we have done some work on training in the area. So we did a LGBT plus, but with really a particular focus on trans training afternoon. I'm having a mind blank of the name we give it. The monthly afternoon training for all GP practices in Southwark. So we're kind of trying to educate through that. I've also done a talk for the local practice nurse forum. So I guess, but yeah, it is a good question. We're hoping eventually, once we've got patients settled on their hormones, we can then give them back to their GPs to kind of take over the care. Because really, it's not all GPs can be prescribing bridging hormones, but they don't feel comfortable to, which is understandable. But if we can get them going and then at least give GPs the confidence to continue managing them, that would be really, I think that's the way we're trying to go.